What are the broader implications, then, of this latest MERS development?
Well, I think there's two aspects to it, really. You've got the sort of direct concern, which is very much related to the public health issues and the fact that this is spreading, albeit spreading at a slower pace perhaps now than it has been. And I think the other concern, obviously, is the impact on the economy, which is in a fragile kind of situation, and any kind of halt in consumer spending or a dampening of activity, people staying indoors, etc., is starting to worry the government that we'll start to see this play out in economic numbers.
So are we going to get any economic reaction to this? There is some talk, and I'm slightly surprised by this, but I guess when you think it through, it makes sense, that we could see interest rate cuts.
Right, so I think bets on an interest rate cut, that's due on Thursday. I think the bets are increasing that we may see a cut. And I think the context for this is important, because MERS itself is not going to be, enough to have that kind of reaction, but we're placing it in a context when exports are already down dramatically. The BOK is in an easing cycle, so we're already at record low interest rates. And then you get, the MERS situation kind of compounding what's already a fairly fragile economy. And I think there are parallels. Obviously, these are very different situations, but there are parallels with what happened when the Sewol ferry sank a bit over a year ago. And again, it's an entirely different situation, but the reaction was one of, people staying in, a lot of events cancelled, a lot of spending down, and the impact on the economy was very long-lasting after that. And I think that's the concern now, is that we may see a similar picture happening.
And how are South Koreans coping then? Life is not as normal as you say, Stuart.
I think it's a very mixed picture. I mean, I understand that it's very much front-page news. It has been for quite some time. You can see more people wearing masks. You can see, we ran a story a few days ago about people who were not going to hospitals, and that was not related to MERS, or fear of symptoms of MERS, but fear of going to the hospital itself where there may be MERS patients. So we are seeing that kind of thing, but I also think it's important not to kind of exaggerate what's happening here. There's very much examples of life happening as normal. So it's a very varied picture, I would have to say.